Hi everyone, my name is Kathy Williams. Today I'm going to do a presentation on how to perform an emergency release of blood products. Objectives for this presentation are as follows. Number 1, upon completion of this presentation, the technologist will be able to prepare units of packed red blood cells for emergency release following the Uinta Basin Medical Center's emergency release of blood procedure with minimal supervision 100% of the time. Number 2, upon completion of this presentation, the technologist will be able to select what compatibility testing is required for different age groups following the Uinta Basin Medical Center's emergency release of blood procedure with minimal supervision 100% of the time. Number 3, upon completion of this presentation, the technologist will be able to report blood bank test results and product dispensing information into the Cerner computer system following the Uinta Basin Medical Center's emergency release of blood procedure with minimal supervision 95% of the time. Introduction. The human body must maintain adequate blood flow and volume to support tissue oxygenation. Low blood volume can cause a patient to go into hypovolemic shock, which can quickly lead to death. Although risky, in some emergency situations, it is necessary to release blood products before pre-transfusion testing can be performed. The proper steps must be followed to provide the safest transfusion. Some examples of situations that may need emergency release of blood are traumas, GI bleeds, or problems in labor and delivery. And in these situations, the need for immediate blood outweighs the risk of giving blood before testing can be performed. The physician or nursing staff will inform the lab that emergency units are needed by telephone or in person. The technologist will gather the following information: patient's name, if available, ID number, if available, location, any other available patient information, and how many units. A different procedure will be followed if the mass transfusion protocol has been initiated. On children under 4, only 1 unit will be released at a time, unless the massive transfusion protocol has been initiated. When selecting a unit for infants, the unit furthest from expiration will be used. Here I have a chart for the selection of blood products for emergency release, but I am only going to discuss the packed red blood cells. First choice would be O negative. Second choice would be O positive, only if the patient is a male or female not of childbearing age. Once the lab has been notified of an emergency release, the units will be taken out of the fridge and 2 segments from each unit will be saved for compatibility testing. The uncross-matched blood sticker will be placed on the unit. The Cerner sticker, if available, will also be placed on the unit. If the blood band sticker is available, it will be placed on the unit also. An emergency transfusion form must be completed before the units can be released. The patient information area will be filled out as complete as possible. The donor type, RH, and unit number of each unit released will be recorded. The ordering physician or designated RN must sign the form before the blood can be released. Here is a copy of the emergency transfusion form. Once completed, the white copy stays in the lab, the yellow copy is sent to medical records, and the pink and green copy are transported with the blood. Once again, I cannot emphasize enough how important it is that either the physician or the RN signs this form before any units can be released. Once the units are complete, the staff ordering the emergency release will come to the lab to retrieve the units, especially if the blood banker is working by themselves. If the blood banker is not working by themselves, they will deliver the units if the physician or RN from the ordering staff cannot retrieve the blood. Before releasing the unit, the pre-transfusion blood component inspection log will be filled out. A unit number sticker off from the unit will be removed and placed in the log. The emergency release order time and release time will be filled in. The rest of the information will be completed. Blood for cross-matching will be drawn as soon as possible, and the patient will be banded with a red blood bank armband filled out with as much information as possible. Compatibility testing for adults will include type and antibody screen, cross-match, and a retype if a blood type is not on file. Compatibility testing for infants less than 4 months will include a forward type, antibody screen, cross-match if positive antibody screen, and a retype if blood type is not on file. The antibody screen and possible cross-match will be performed on maternal serum or plasma if needed. Compatibility testing for infants greater than 4 months and children will include a cross-match, type and antibody screen, and a retype if a blood type is not on file. The physician will be notified immediately if there is any evidence of incompatibility. The nursing staff will be notified once compatibility has been verified. Once compatibility testing has been completed, results will be reported in Cerner in PathNet Blood Bank Transfusion Result Entry. Units will be dispensed in Cerner in the PathNet Blood Bank Transfusion Dispense and Assign Products Dispense mode by entering all required information. Automated ProView printouts will be placed in the patient results binder. Manual results will be entered into the blood bank logbook. In conclusion, the emergency release of blood products process can be stressful. However, don't let it drive you mad. Follow the SOP, practice competency often, and stay calm, and it shouldn't be that bad.